Hey guys, my name is Lexi Adkins. I am coming to talk to you about the opioid crisis and what we are doing about it as far as healthcare goes. We are in Kentucky in the middle of the opioid crisis. We see some of the highest numbers of overdoses from opioids, and we see some of the highest number of prescribed opioids from the hospital setting. I'd like to start by going through an article that I found. It was posted by ABC 36 last year in November of 2018, so a little less than a year ago. The title is Kentucky Continues to be at the Center of the National Opioid Crisis. It kind of goes into detail a little bit about what that looks like in Kentucky, some of our rates of overdoses, some of the things we see, how our rates of overdoses are continuing to rise rather than get better. So I think this is a really important topic to go over what we as healthcare professionals are doing about it. In this article, it says that Kentucky and Ohio and West Virginia are 3 of the top 10 worst states for overdoses. So we see the highest numbers. So we really are right in the middle of the hub of overdose and where it happens the most. So this is really important for us in Kentucky as well as the rest of the United States, but this is really important for us. I'd also like to talk a little bit about yoga and how that can kind of help combat the issues of opioid crisis. So I know a lot of times in healthcare, I work in the ER and we see patients come in, they're in acute distress, acute pain, we don't know what's going on, we don't have a definitive diagnosis. A lot of these patients get opioid pain medication in that setting, and either until we get a definitive diagnosis or even thereafter, especially if they're admitted to a hospital, if they need procedures, if it's something that they have to wait to follow up with a primary care physician, they may get some pain medication to get them through until that time can happen. There's a lot of scenarios where these patients come in and are prescribed or given in the inpatient setting opioids. I think that this is a great thing that we have access to these medications and can treat patients, but it also can kind of lead to this crisis that we're in right now and worsen the issue. A lot of these patients are given these medications in the inpatient setting. Perhaps they're admitted for a procedure and they're in the hospital for several days, and that whole time they're given these medications. They're not weaned from them. They're not told what happens whenever they stop taking them. They've never taken them before, so they're kind of naive as to what this looks like and what happens thereafter. So these patients go home and they may still be in pain, and the pain medication that they're given at home that are non-opioids just aren't taking care of it. I think this happens more often than we really acknowledge in the healthcare system. Again, I think these opioids are a great resource for us as healthcare workers, but they can be overused, and oftentimes the patient's perspective and understanding of these medications needs to be further explained. To help combat this issue, I think, especially in an outpatient setting, these patients can talk about other treatments, including yoga. Yoga can, one, not only treat acute pain, it can help treat chronic pain as well. It can help with weight loss, things like depression, anxiety, headaches or migraines. It's proven to help those. It's also been proven to decrease high blood pressure. So there's lots of reasons why yoga can be a therapeutic use for these patients, not only for pain treatment, for other things as well. The reason these patients need to be taught about yoga and the reason that they should think about using yoga is, of course, there's fewer risks to using yoga than opioids. There's a lot less fallback. It's pretty accessible for anybody. I know when doing my teaching plan, I came across several yoga studios here in Georgetown, which is right outside Lexington, and there's plenty in Lexington as well. Most cities have a few studios who are able to provide this resource for these patients. And if not, they can also talk to their primary care physician or follow up with somebody who takes care of them in an outpatient setting to talk about what that looks like and the resources they have in their own community. I think it's important for these patients to be reminded that yoga can be of therapeutic use. However, it may not take care of their pain completely, so they still need to seek treatment from their providers as well, and always talk to them before they undergo any new treatments. In teaching these patients, and specifically I would like to focus on patients in the ER. So they come in, they're given medications, perhaps they're given a diagnosis that doesn't require opioid management, especially once they're discharged home. So they need to be given other resources other than medication that can help treat this acute pain until we can get the cause of the pain under control, perhaps in an outpatient setting, a procedure later down the road, or something like that. So I think these patients can be given yoga therapy as an option. We kind of go through why it's important to use it, and what their resources are, and how they can get a hold of somebody to know all of their resources. Once this is done in the ER setting, I would like patients to understand why it's important to go to yoga first, or other types of therapeutic treatments rather than opioid usage. And then we can talk about what that looks like after discharge, talking to their primary care physicians for follow-up, and just really understanding the use of yoga and how that can really combat their pain or whatever they're using yoga for. I think that these non-opioid therapies can be really useful, and they're not used as much as they should be in today's healthcare systems. So I hope this helped, and I hope that yoga therapy is something that we can use in the future.